Okay, fantastic. I think we can go ahead and start. We have a full lineup, and I want to make sure that we have time for the presentations and Q&A. So welcome everyone to the EPIC West Africa Regional Webinar on Going Online. We're focusing today on the online demand creation. We did have a survey that was circulated in January, trying to focus on areas of interest and demand creation, and also mapping size estimation on the virtual space was the top choices. So let's move to the next slide, please. So hello, I'm Tiffany Lilly. I'm the Technical Director for Prevention, Testing, and Community at FHI 360. I've been at FHI for the last 7 years. I've been technically backstopping West Africa Regional, Togo, Burkina, Senegal, Ghana, and Burundi, so mostly the Francophone portfolio within our program. I do have a master's and doctorate at Hopkins, and I've worked previously with USAID, Cote d'Ivoire, and Office of HIV and Washington. I also worked as an international consultant in Morocco and Armenia with various funders. So let's move to the next slide, please. And we have the opportunity to really learn and grow as a team and as a region in the telehealth space. So our facilitator today is Shanti Norega Monticello. She's the technical advisor for FHI 360. She has been with FHI for the last few years, focusing on the Going Online portfolio, and has worked across the region within West Africa and East Africa, and has really provided a lot of quality support with this growing portfolio. As we know, we started the Go portfolio before COVID, but as we know with COVID, many of us are working virtually, and there was a lot of hesitation on going to services. And also, we just needed a little bit more support with the Going Online demand creation, and also technical assistance and case management using more the virtual space. So she was also previously a deputy director at FHI's Neglected Tropical Disease, and was the associate director for strategic information at the APRO office, which is the Asia Pacific Regional Office. So welcome, Shanti. We're looking forward to you facilitating the session. Next slide, please. So the objectives of the webinar, just to ground us a little bit more on what this 2-hour session is going to be focusing on. So with this, we are focusing on demand creation, and the objectives are really to familiarize ourselves on the way social media can be used to generate demand for health services, and also give participants concrete examples of how social media is used in programs. And the overall objective for social media and using social media for demand creation is really to engage individuals who are not accessing services within the standard format, and getting them linked to client-centered differentiated service delivery. So moving from the offline to physical space to provide HIV self-testing, linkages to STIs and testing and ART if they're positive. So this is really an avenue to reach a new cadre of participants and clients who are not accessing the standard services for one reason or the next. Next. So the agenda today. So we have the welcome and introduction. We also have a presentation by Shanti to go over the social media use to promote services and engage clients. We also then have a short Q&A session to go over any of the concepts that are shared by Shanti. And then we have Afrani from Jamaica, who's going to provide a presentation on his important work for the peer-led online outreach and maintaining a social media presence, followed by a short Q&A. Next. And then we have the GAMA team. Samuel's going to share the ways that they're using the online space for demand creation, especially around PrEP and HIV self-testing. And then we have our South Africa consultant, Theo, who's going to be sharing the managing Facebook ads and introduction to Facebook Ad Manager, which is one social media channel that many of us use, and using ads that then are able to link individuals to services. Next. And then we have the closing and evaluation. Next. Okay, so welcome. And I'm looking forward to an engaging couple hours. And Shanti, I'm going to hand it to you. Thank you.
Great, thank you, Tiffany. And hello, everyone. As Tiffany mentioned, my name is Shanti Noriega, and I'm a technical advisor in telehealth at FHI 360. And during today's presentation, I will be giving a background on why social media can be really a powerful tool that we can use to promote services. As Tiffany mentioned, it's a really powerful tool for making sure that we can reach those last mile clients. So those clients that for whatever reason may not have engaged in programs before, but we're really leveraging the fact that more people are becoming connected. And so this really social media engagement really helps us reach clients that we might not have reached before, who in some cases might have higher risk profiles. And so we'll be going through some of the tools that are available to you and some of the various different types of examples that we have from the field. Next slide, please. Great, so during this morning's presentation, I will be giving a very general overview about why we use social media. I'll be presenting a roadmap for social media use, tools and approaches, and I'll also share some additional results that we have from some programs outside of the ones that you will be hearing about today. Next slide, please. So why use social media? We'll begin by looking at some of the trends in access and social media use worldwide. So now, as I mentioned, more than ever, people are becoming increasingly connected. And while we do still have some gaps, particularly in between rural and urban, but also some sex-specific gaps in terms of the differences between access and use between men and women, these gaps are increasingly becoming smaller and smaller. Next slide, please. So these are some trends that we're seeing in social media use around the world. Digital 2022 is an organization that publishes annual reports, and it's a useful analysis of access and use across the globe. They produce a global report, but then they also produce country-specific reports. So if you're interested in seeing what internet penetration looks like, what social media looks like in your countries, you're welcome to access the link at the bottom of this slide, which will give you access to the data that we're seeing. So as you see in 2022, social media is used by over half of the world's population, and this has increased by 10% from last year. Of the almost 5 billion internet users, the majority, 96%, have smartphones, and these users on average across the globe spend about 2.5 hours per day on social media. And we've seen some trends in some countries like South Africa, for example, where people are reporting daily use of more than 7-8 hours. So people are really heavily using their smartphones, and they're using those to access social media sites and applications. As I mentioned, there are some coverage gaps. So areas where people are living and have no broadband network coverage. But again, that is increasingly becoming smaller and smaller. And currently the global average is about 20% of people do not have access to internet. We also see that gender and rural urban gap, with women about 37% less likely to use mobile internet than men. Could I have the next slide, please? Okay, so again, here are some more statistics on global social media use, and you can see how this continues to increase. So in 2022, 93.4% of internet users were also using social media, and men use social media more, although this is most likely due to the gap between men and women in access to smartphones and internet. Could I have the next slide, please? Here's an overview of the percentage of the population using social media across different regions. So you see that there's some really big differences across some of the regions, but more and more we're starting to see that people everywhere throughout the world are beginning to use social media. And these are percentages compared to the total population. Can I have the next slide, please? Okay. And here's a slide I wanted to show you. So this is a percentage of internet users and social media users within each of those different regions. And here you can see the differences between the genders, which I was mentioning earlier. We do see some consistent gaps in the gender in some regions, largely men having probably a little bit more use and access to social media than women, although that's becoming much smaller. And you see that the gender balance in the use of social media really differs. In some, you see actually more women are engaged in social media as men, but in others, most notably in the African continent, we are seeing this gap that exists between men and women. Although again, that is becoming increasingly smaller each year. Next slide, please. This slide shows some of the most popular social media platforms among internet users aged 16 to 64. And several of these are chat applications. So we're seeing that people are engaging very much on applications like WhatsApp, WeChat, Line, and Facebook Messenger. They're using that to communicate with friends and family, but they're also using it for work as well as, in some cases, shopping. So it's important to note, because sometimes chat applications, when we're talking about engaging in social media for generating demand for services, these chat applications might be a little bit more difficult to access with social media campaigns because they're actually more closed, right? So they're generally groups of people that include a limited number of users in each chat. They're generally friends and family. And so it can be a little bit challenging to access those types of chats, but not impossible. But conversely, the popularity of other apps like Insta, Facebook, and TikTok, those are platforms in social media that really provide opportunities to more easily reach people through paid advertising. So just wanted to show you what some of the more popular social media platforms are, and bearing in mind that you really need to think about what different social media platforms are available, which ones are the most popular, and how feasible and accessible is it for you and your program to access those and use those for demand generation. Next slide, please. When we look at the types of social media accounts that are followed, again, it's interesting to look at the types of people that people are following. This can really significantly help in a social media campaign because it might give you some ideas about who it is that you should reach out to, who can help promote your services. Here we're seeing, some of the information about the accounts that are being followed in terms of friends, family, and people we see that that's the majority of accounts that people follow, which isn't a big surprise. But then you do see that a lot of people do follow actors, comedians, and other performers. And so those are the types of people that you can leverage to become influencers for you and who are influencers and who can actually help promote your campaigns. One of the things that we noted in looking at data is that women tend to follow social media influencers more than men. And this is particularly true among the younger age group, where about 30% of young women aged 16 to 24 follow influencers as compared to men in the same age group, where they're about 26%. So this is really important to consider when you're thinking about who you're going to reach by engaging these influencers in your ad campaign. Next slide, please. So now that we've looked at the data, we've seen some of the trends, we've seen some of the types of social media that's being followed. I'm going to present a roadmap for social media and telehealth. And so what we're seeing right now is really a shift from the traditional face-to-face interaction to a new generation of social media facilitated by social media facilitated interactions. Next slide, please. So here's a slide of how the generations of outreach and the way that we interact with clients has changed over time. We see here how it's evolved from moving to a more online approach that can reach larger numbers of people. This means that our reach is broader, but we need to consider how to best convert online reach to offline engagement with services. and using social media also implies a more sophisticated approach to segmenting your population and targeting those you can reach. So when we were talking at the beginning of our programming, we used to do a lot of one-on-one outreach with clients. Then we started to kind of mix one-on-one outreach with social media use, maybe using some platforms like Insta, Facebook. But now more and more, we're starting to really rely on social media use to reach larger groups of people. But that also means that we need to understand who's using those platforms, who are the people that we want to reach as part of our program, so that we can better define the platforms that are going to be the most effective in reaching the people that we want. Next slide, please. Here's a roadmap for social media use in telehealth. So this roadmap really outlines critical points in the planning, implementation, and evaluation of social media campaigns. And so planning really involves having a very clear understanding of your target audience and the social media they use. So if you're targeting young women, maybe you do want to look at influencers that are very popular in your country, because we have data that says that women tend to follow influencers more than men. Reaching your individuals that you're targeting, it really involves creating ads and content that resonates with that population. And that often can be facilitated by the use of creative ad agencies in your country. They can develop visuals, they can develop messaging by studying the population, having various different focus group discussions with your population, maybe even doing some in-depth interviews with the population to better understand the types of ads that would resonate with them. And they can also help you in identifying the different various platforms that might be most effective for reaching your population. So once you have the population and you've reached the population, a program really needs to have a strategy to convert the online interaction. So whether that's clicking a link or engaging with an online peer educator, to an offline interaction with the healthcare service of interest. So there's still that challenge of, once you've engaged the client online through the use of social media, what are the steps and what is the plan that's going to be put into place to make sure that that online interaction really translates into the person coming into the healthcare services to receive the services that they require. Can I have the next slide, please? So just in summary, some of the considerations that you need for online marketing, it's really around that planning. It's really around understanding who your clients are and who you want to reach, engaging in the creative and design needs. So what's going to resonate with your audience? What's the cost related to that, right? So there's going to be costs that are related to developing your ads. There's also going to be most likely a cost related to advertising online. And we'll hear a little bit about that when we talk about like the Facebook ads that my colleague Sato will present about later on. You also want to make sure that you track your results. So online ads can be easily tracked largely through the ad managers that a lot of these apps have. And they really help you identify which one of the social media platforms that you're using is essentially resulting in more people engaging with your program. So as you move forward with your programming and your social media use in the future, you have a better idea about which platforms are actually the ones that are going to be the most effective in reaching the people that you want and engaging them. Next slide, please. All right, so we're just going to talk here, next slide, about some of the tools and approaches. Can you click that one more time? So when we look here at the HIV cascade, we have here on this slide the cascade for telehealth programming. And I want to draw your attention to these two steps at the beginning of the cascade that are really related to identifying and reaching clients. So here we see some of the tools and approaches for generating information on our population and their social media use. And these include using size estimations. It includes mapping social media sites used by your populations of interest. So you can engage with your partners, you can engage with your clients, you can ask them what types of sites they use, what types of apps they use, and go through a snowballing process until you start getting repetition. And so then you are sure that you have a clear list of all the sites and applications that are being used by the population of interest. Social media ad managers can also help you know how many people you can reach. while social media mapping will help identify the social media platforms you want to target. So often things like social media ad managers, like the Facebook ad manager, will help you with understanding the different types of users that you can reach, the volume of users that you can reach. And so that can also help you identify what pages on Facebook, for example, might be the most effective for reaching a larger number of people, and what other types of demographic information is relevant for the people that are using those sites. So that way it helps you better make sure that you've identified sites that are really being used by your population of interest. So once you have all of this information, you can plan and launch online marketing and demand generation campaigns. And that might include the paid online ads, like I mentioned before, and also the use of social media influencers. So these are people who are influencers for the population of interest, and they can really be engaged to promote your services, to help make sure that your clients are linked to the services of interest. And you'll hear more details about how some of these approaches can be used in our country presentations. Next slide, please. I'm just going to finish up here with a few slides that give you an overview of some of the results that we've had when using social media. It'll give you an idea about what can be achieved. And often you can track results to the ad manager pages that I've mentioned. And these data can really help identify, again, the most successful sites for engaging your population. And that information can really be used for informing future campaigns. So here we see a social media influencer outreach in Jakarta. And you see here over time, the different periods of time when they were doing different outreach online. They were using trendsetters and people with large reach. So essentially they were engaging with influencers. And you see here that as a result of those campaigns, the HIV case finding at the clinics in Jakarta, that was corresponding with program activities. And so the influencer promotions between the period of July and September corresponded with like a 23% increase in HIV case finding, and 58% increase in updated status in clinics. So here you can see clearly how the Indonesia team was tracking the different campaigns and what the result of those campaigns was in terms of case finding. So they were really effectively using these campaigns to engage higher risk individuals and increase their case finding. Next slide, please. Here we are looking at some of the ads that were designed for Nguan, which is an online reservation and case management app in Cote d'Ivoire. And they helped link the online service, the online platform helps link clients to services. So clients are able to actually go online, make their own reservations. They can also talk with online peer educators. They can chat with online counselors and other outreach workers if they have any questions. And in this particular case, with these campaigns that were run to promote Nguan, they saw that they had a 12% case finding, which was higher than the traditional outreach approaches, which were the face-to-face interactions. And you see that their case finding increased to 14% in fiscal year 22. Next slide, please. And here we have another example of using online case management and online service promotion, in Thailand. And so in Thailand, they also used the online reservation and case management app largely to really draw people into the services. They used networks, so identifying different people and having them promote the sites. They used influencers. And in Thailand, we have a country where there's a national social media use that's relatively high, almost 79%. So they were able to really reach a large group of people. And one thing that we also saw in these particular programs in Thailand was that 69% of the clients they reached online were actually new clients to the program. So again, demonstrating how you can effectively use social media to really engage those individuals who may not have necessarily ever been reached by the more traditional programming. As a result of the online outreach, we know that it contributed to the overall program results in terms of prevention, in terms of getting people tested, as well as in terms of HIV case finding, which in this case was about 15%. Next slide, please. Okay. I'm just going to finish the slide with a few resources that are available to you. You will be receiving these slides. So these are some resources that you can look at as you think about using social media. There's some websites. Here we see some advertising tips. It gives you also an information on the common terms that are used. So if you want to learn more about how you can use online advertising, this is a great, the BHOC site is a great resource for you that can provide an overview. Next slide, please. In addition, the Going Online team has developed a significant number of resources available to you that can talk about how you can use various different components of virtual interventions for your programming, but you also have here some information that gives you some briefs that are specific to how you might want to use social media for advertising. Final slide, please. So thank you all very much. I hope that the information that was shared with you is relevant and gives you a great, a big overview of what types of social, or how social media can be used for generating demand. And before we move on to the country presentations, I think we have a few minutes for any questions and answers that people might have. Thank you so much.
Yeah, thank you so much, Shanti. As individuals start typing their questions into the chat, while we have space, can you just maybe provide more details on some of the challenges? Because it might be intimidating to start thinking about offering and developing this online program. So could you just, if individuals want to start, what are some of the challenges in the beginning, and then how have they been overcome? Thank you.
Yeah, thank you, Tiffany. I think that's a great question. I think that it's definitely a challenge when you're first embarking to really understand how exactly to identify the sites that your populations might be using. And so that's why one of the things that's really important at the onset is really trying to understand what those patterns of use look like. And the best way to really do that is through the engagement of the key population of interest, really bringing them on board from the very beginning at the inception of all of this to really understand what their use patterns are and to help them help you identify what sites they use, what influencers they might be following. I think another challenge that a lot of countries have is then the engagement of creative agencies for developing the content, right? Because often this is seen as something that's really relatively expensive. Maybe a lot of programs haven't had engagement with professional creative ad agencies in the past. And so more and more we're seeing that there's these creative agencies that are working in the regions that are really specialized in terms of the health promotion and have experience with supporting nonprofit organizations in developing the content and supporting them in that. And I think sometimes that can be a challenge for countries, is identifying who can be there to support them in the design and the creation of all of this. And also, how it is that you go about paying for these ads. But as we get more experience, people in programs are getting much more familiar with being able to reach out to places like Facebook or Tinder or Grindr to be able to engage them and to pay for those ads. And I think one of the biggest challenges that we see across our programs is really that online to offline engagement. So how do you transition somebody that you've identified online, and how do you adequately engage them so that they actually follow up with a physical visit to facilities? And a lot of that, we've seen that that's where our online peer educators can really be great facilitators in either helping the client physically gain access to the clinics, or else with following up with clients to understand what are the barriers to them actually moving from that online to offline process, and what are the resources that they need to help do that. So we think that we've seen that in a lot of our programs, that online peer presence can be a great facilitator to engaging the client and assuring that there's that follow-up, similar to what we would do with traditional face-to-face outreach, where a peer educator might actually physically accompany a client to the clinic when they engage at the community level. Doing that with an online peer educator is also possible and has been effective in really helping that engagement. So I think those are some of the bigger challenges and solutions.
Yeah,
and
thank
I
you
see
so
that
much.
people are also putting comments and additional answers in the chat.
Yeah, thanks. There was a question from Molly Almadi, who was asking the same question on how to really have that online engagement and having some influence or encouragement, motivation on pulling that person into an offline space, a physical space. Fatu, are there any other questions I might have missed?
Yes, I am adding them very shortly. Ben had a comment, so if Ben, you want to be off mute, please feel free, and I'll add the other question. Thank you.
I don't know if Ben maybe has a connection problem, but I do want to address his comment, which I think is a valid one. And it's really breaking through the noise, right? Because there's so much on social media. People are bombarded with so many different things that really breaking through that noise to have a very valuable campaign that's valuable, interesting, and engaging is also a big issue. And so as Ben said, it's even harder when we work in countries where key population experience high levels of stigma. So you definitely need to make sure that that engagement is valuable and it's something that will actually engage that client that you're targeting.
Yeah, thank you. And I do see a hand. Cecilia, did you want to come off mute? Fatu, can you help her get off mute and ask her question?
Yes.
I've allowed her to talk. She should be able to unmute.
Okay, great. Et aussi, si vous voulez poser les questions en français, Chanty, elle peut parler français aussi, donc elle peut répondre. Merci. Cecilia? You can ask your question. I see you're off mute now. Thank you. Okay, we don't seem to hear her. So Cecilia, you can put your question in the chat and we can respond. Shanti, do you want to go ahead and introduce the first presenter?
Absolutely. If I could see the next slide, please. So our next presenter is Anthony Grizel. So he's an online outreach worker for iFlex in Jamaica. And Anthony is passionate about community work and has participated in several LGBTQIA plus focused projects in the region. He will be presenting, Anthony will be presenting on projects around how iFlex has used social media to generate demand. Anthony is an activist at heart, and they consider themselves more impactful behind the scenes, where they have found passion and dedication to community activism, and focusing really around empowering queer people, especially through online engagement. In their downtime, they flex their artistic muscles by writing poems and stories and enjoy reveling in the company of their friends. So Anthony, thank you so much for being with us today. I'm going to pass it over to you.
Am I off mute? Hi, everyone. I'm Anthony Grizzle. I'm an online outreach officer at iFlex, and it is my pleasure to be here to speak to you all about peer-led online outreach and how we maintain a social media presence. Next slide, please. So what is iFlex? iFlex is a virtual health campaign that targets men, mostly young men. We provide services and support to improve their overall health, as well as health-seeking behaviors. iFlex was created by the Children First Agency in 2018 with support from USAID through FHI 360's Linkages Project. We offer HIV and syphilis testing services, which are promoted through peer-led online outreach. Next slide, please. So let's talk a bit about our online outreach program here at iFlex. So we currently have 3 members on the online outreach team who are trained in navigating dating apps and social media sites to 1, identify clients, engage them in prevention messaging by sensitizing them about safer sex methods, such as proper condom usage, PrEP uptake, and the importance of getting tested. The necessary support is then provided to facilitate clients with accessing testing and other related services. Our online outreach is done through direct one-on-one engagements via social media messaging and dating apps, or by maintaining a social media presence with campaigns and posts, which prompts audience to reach out to access our services. Next slide, please. So how do we do our one-on-one engagements? So our one-on-one engagement takes form in what we call the messaging matrix. So with this messaging matrix, we strategically initiate chats, we build rapport, and we offer our services. So let's start with initiating chat. We first identify the clients online. We introduce ourselves and our services and acknowledge these clients. We then take the opportunity to find out more about the clients. We respond to any questions they may have, and we help them with assessing their risk. With this information that we're given, we can then effectively aid our clients in accessing our counseling and testing services. Next slide, please. The process doesn't stop there though, as we also use the My Health JA, our oral link, which we give the clients the link. And with this link, they can assess their risk, they can do their own risk assessment, right? As well as booking HIV and STI tests. Importantly, our case managers also use the online reservation and case management tool to refer their clients to treatment services. Next slide, please. So in this slide, we'll talk about some important considerations to make when doing online outreach. So we have dedicated team members. And with this dedication and flexibility, this increases the chances of meeting clients online and thereby increasing the potential of service uptake. So the direct one-on-one engagements online, we do that. We expand ourselves and make ourselves flexible to extend beyond the 9 to 5 hours, because during the 9 to 5 period, clients may not be available. They might be at work or busy, so we extend ourselves beyond those hours. Our team members create profiles on dating apps and social media whilst engaging in a warm and friendly manner but still maintaining professional tone and boundaries. The team is also strategic in ensuring that members of the LGBTQIA community are a part of the online outreach team. This aids in navigating dating apps, especially when talking to MSM, as they're able to better build rapport. And this creates a comfortable environment for MSM. We also make sure to use the messaging matrix, as this provides a suggested chat flow to team members so they can properly provide key and impactful prevention messaging to our clients. Next slide, please. So how do we maintain a social media presence? This is a very critical component of online outreach, as we're able to remain interactive and attractive and insightful by using these factors. So we have regular content planning meetings. We make sure to post regularly, as that increases the possibility of our posts showing up on person's feed, especially with Instagram. We tap into online trends. So we make sure to create programs and campaigns and posts that are related to these online trends, especially trends that with the MSM or the target population will be interested in. We also go live on Instagram, and we respond quickly to our clients. We respond in a very timely manner so that they know that we're there and we're able to interact with them. Next slide, please. So these are 3 sample contents from what we have used on our page. So one of our strategies, usually implied in content creation process, is being intentional in the selection of images that are likely to appeal to our target audience. So this includes using our influencer marketing by finding persons that the target population would be interested in, people that they would know, people who have also accessed our services. So we pair these images with innovative and creative messaging. We can see the middle image, which this middle image was created during the peak of COVID. So we use this graphic to play on not protecting yourself against COVID and also protecting yourself against STI. So this was a one-go image that was able to, this image was able to go speak about COVID and also speak about protecting yourself with STI. So going out, you would keep protected with wearing your mask. Going in sexually, you would be protected with using a condom. Next slide, please. So these are 3 of our sample campaigns. The first one is the Doing It campaign. So this campaign encouraged sexually active persons to protect themselves while doing it. I'm doing air quotes now, but you can't see it, by engaging in safer sex methods. For this campaign, we included the Minister of Health. So in this image, that's the Minister of Health for our country. So we use the Minister of Health to appeal to the masses and also endorse the brand image. So in the middle, we have the Put a Cap on It campaign, which was started in Safer Sex Week of 2022. With this campaign, it was a play on the song Lick by Shensia, who is a Jamaican artist, and Megan Thee Stallion. So there's a line, put your back in it. So we use that line to say, put a cap on it, which would, putting a cap on it would speak about proper condom usage. So this was an example of us tapping into trends. The third one was the iBoost campaign, which was geared towards physical health and vaccination. The messaging around this campaign was to inform our audience that regardless of status or lifestyle, it is important to boost your immune system and stay protected. Next slide, please. So this is an example of us going live on Instagram. This is a screen cap from one of our Instagram live programs that was called He Said, He Said. So He Said was a lifestyle-based program done in a very relaxed vibe, and it focused on discussing the myriad of issues faced by men on a daily basis. The host would also talk about sex-related topics and creatively integrated key messages, for example, safer sex methods and getting tested. So one of our approaches is creating a relaxed vibe, speaking about a topic, and then also incorporating safer sex methods, because sometimes people would get wary of with just putting safer sex information at them. So sometimes they would better receive this information in a more relaxed vibe. Next slide, please. So we're gonna highlight some other noteworthy considerations when doing online outreach. So a seamless process is undertaken for clients who are reached online, as team members provide the necessary step-by-step support to facilitate access to service. So once these clients we talk to them online, we get to offline them, we make sure that when they get in the space, it's a very easy and seamless process. So selected team members are also always knowledgeable of social media management and content creation, because this plays a very important role in the duties that we do. So making sure that our team members understand social media management and content creation is very important. We also make sure to provide counseling for outreach staff as they navigate the challenges of the online space. We have had some very interesting experiences. So during online outreach, we might encounter a traumatic story, or some clients may not be able to, or they have difficulties with respecting boundaries. So having a psychologist readily available, so we have a psychologist here readily available, proves itself useful in making sure that our staff is constantly and always in the best frame of mind, because safer sex practices is one of our main priorities, but we also promote mental health and physical health. Next slide, please. So our efforts have resulted in the following. So these are some results that we've experienced over the last year. 1 in 5 clients reached online between October 2021 and September 2022 were tested for HIV and syphilis. Over the last 3 months, our posts have reached 7,848 accounts. And so one of the tactics we use is that Reels are very popular on Instagram. So using Reels and posting more regularly will increase the possibility of reaching more accounts. One person that was tested positive for HIV has been linked to treatment. So we had only, out of the people that we've reached online, only one person was tested positive for HIV, and we have been able to link that person to treatment. Out of the amount of people that were reached online, 8 of them were tested positive for syphilis, and they have also been linked to treatment. Our online outreach team has contributed to 57% of the service uptake within the Children First Agency between February to September of 2022. Next slide, please. This shows the people, so this chart shows the people that we've reached through peer-led online outreach. So these are the people that we've spoken to and been able to share our safer sex tools and methods with. And there should be a total amount. Give me a second. But yeah, so this is the breakdown from October 2021 to September 2022. So these would be people that we have DM'd, messaged on Instagram and dating sites. Next slide, please. So what are some of our way forwards or next steps? So going forward, the team will definitely further integrate the upgraded version of My Health JA as we promote in our different online spaces. So we'll make sure to include the link for My Health JA Aura, the Aura link within the post that we make when whoever we speak to online on our dating sites. We'll make sure to include the link for them to do their risk assessment and book their appointments. We'll continue to use influencer marketing as that has shown an impact, and so we'll continue to use this to our best ability. And finally, we'll explore having our peer navigators using My Health JA more. Next slide, please. So here at iFlex, we continue to be creative in expanding our services and improving innovations while staying connected to our target audience. So you can follow us on Instagram at iFlexJA, on Facebook at iFlexJamaica, and TikTok at iFlexJA. So that is the end of the presentation, and I will be taking questions now.
Great, thank you, Anthony, for that presentation of the innovative and exciting work that you're doing with iFlex in Jamaica. I believe that there are a few questions in the chat that you might want to look at. I think there are some questions here about when you're using live on Instagram. Do you give the messages concerning all the targets? Oh, I see. Okay, so how, I think the question here is really related to how on a live platform or live feed like that you might do on Insta or on Facebook, how do you make sure that the message is actually reaching the key populations when you might be actually reaching a larger and broader group of people through those platforms?
Oh, yes, that is a very good question. I think so when we're going on live, there's a notification that's normally sent to the followers. So our majority of our followers, as we've seen so far, majority of our followers would be key population. But yes, there would be no specific way to control who views the stories or who views the Instagram live. But we tailor our lives in a way that it would definitely be speaking to issues that would be faced by the key population or target messages that will appeal to the key population.
Okay.
Easy
No, I think that's I think that there was a question here just very broadly around how you can create successful online campaigns.
Yeah.
I think that you gave an overview of that. Maybe you can just recap some of the key considerations that people should consider based on your experience.
Online, oh, the one about online campaigns. I think that was, what number slide was that again? Give me a second. So some of our key considerations when doing online campaigns would be definitely to tap into trends. So find out what is trendy, in your country. That's for one. Because yes, the key population would have like specific things that would be trendy to them, but there are some things that are popular within your country that is popular throughout all populations. So you find those key things, those trends, and then you would tailor it in a way that would appeal to the key population. We also use influencers that are popular within the key communities.
And Anthony, I'm sorry, go ahead, please.
Go ahead, what was the question?
Speaking about influencers, I see that Judith here on slide 51 was asking specifically about how you contact influencers and whether or not you pay them or if they do it for free. And I think a question around safeguarding as well, how do you make sure that they'll not expose your organization or put your key population members at risk?
What was go again with the last part of that question?
The last part of the question was really how to make sure that the influencers will not expose your organization. I think that's particularly relevant within the context of working with key populations in highly stigmatized environments and how you might protect them.
All right, so for the last part of that, we create a criteria. So we make sure that there's a specific criteria that they will have to fall into, but there's not necessarily a way that could definitely control what these influencers would fully do, but we make sure to create a criteria that they follow.
Okay.
Could you remind me of the first part of the question?
That was just really around, I think you pretty much answered the first part, which was how do you find influencers? But
Okay.
There was a question regarding whether or not you pay your influencers.
Okay, so we do pay our influencers. Some people some people are willing to do sometimes for free, but we do have payments for our influencers.
Great.
I saw a part about treatment services. So we do have a partnership with a company, our community partner called JASL. So that's the service that we refer them to, or sometimes we take them to these treatment sites to make sure that they're adhering to their treatment.
Yeah. And we had one question here in French regarding the percentage of people that you reach compared to the number of people that you found that were positive, and whether or not that actually poses a problem within your program for, you're reaching quite a lot of people, but you're not really finding too many cases. Anthony, did you hear that last question? I see that there's a similar one in English as well, just in terms of the number of reach and number of tested positive.
I was muted. Sorry about that. I didn't realize that I was muted. So we do realize that, yes, that poses a problem, but we're currently trying to work on ways that we can better identify positives. So it does pose a problem, but we're working on ways that we can fix this.
Okay. Sarah, I believe that there was a quick quiz that we were going to share with participants at the end of the presentation.
Yes, before moving to the presentation, there is one there's one last question regarding the link between Instagram and Aura. How do you link Instagram data to Aura? Thank you.
So for the insights, the regular Instagram insights, there's there isn't specifically a way to track everybody that views our posts, but for people that we talk to, we would send the only way that they could be linked to Aura is if they go ahead and do either the risk assessment or they book an appointment. So we make sure to share the link with everybody that we speak to on Instagram.
Yeah. And I believe also when you have an online campaign and you want the people to link to an online reservation app, you can use specific codes in your link that would then also let you know where those people came from. So that also helps you understand which of the sites and apps that you're using are the most effective in reaching and engaging the clients. So you can create specific links for each of your campaigns to be able to track that.
Yes, we can.
Okay, so we have a poll here, just 2 questions that would help just kind of talk about some of the main points that Anthony shared with us. The poll is in English, but the French questions have been put into the chat. So if you're more comfortable using the French, please review, look at the questions in the chat, and then you can respond to the poll. And we'll just take a minute or two for this poll before we move on to our next presenter. But are we getting some results from our poll? Okay. So the first question was around which of the following best describes peer-led online outreach. And so the majority of people identified reaching social media dating app users with prevention messaging, which is correct. And how do programs maintain a standard social media presence? Regular, and this was a multiple choice. And so the content planning, as Anthony was mentioning, making sure that you're consistently planning and reviewing your data and reviewing the results, and also keeping your posts regular so that you're able to make sure that it's alive and a thriving campaign. Okay, so thank you everyone for participating in that. We're going to move on now to our next presenter, and it's my pleasure to present to you Sammy. Sammy is an M&E officer with the West Africa AIDS Foundation, and has been working with HIV programming for over 5 years with key populations in Ghana. He's currently supporting implementation of 3 different HIV interventions. And Sammy will be presenting today on Ghana's online demand creation approaches. So Sammy, thank you very much, and take it away.
Hello, everyone. Good morning, afternoon, depending on where you are. Okay, so my name is Samuel Nibote Mensah. I will be presenting on behalf of West Africa AIDS Foundation and the Ghana team on Ghana's online demand creation approaches. So WAF's main mandate on the EPIC project is to reach KPs that are hard to reach, KPs that are usually unreached, and then high-risk KPs through social media approaches. And we currently work in the East District of the Greater Accra region of Ghana. We also work hand in hand with our sister clinic, which is the International Healthcare Center. Okay, so WAF is using online platforms to create demand for PrEP and HIV/ST, and then also COVID-19 among KPs in the intervention area I mentioned, and east of the Greater Accra region of Ghana. And then we use online demand creation strategies to reach the hard to reach, the unreached, and then the high risk population, as I mentioned earlier, and then create demand for PrEP, HIV, ST, and then COVID-19 services to increase uptake of these services. Currently, WAF uses 7 peer educators and then 9 PrEP champions who have been trained by WAF to, with the support of FHI 360, to create demand for PrEP and HIV ST on social media platforms. And over the years, social media has proven to be a very useful tool in reaching the hard to reach KPs and also high risk KPs. And so the reason why WAF is focusing on social media approaches and reaching key population in Ghana. And given the terrain of Ghana in terms of key population, we believe that it's very important to reach key population through social media, which makes it very discreet to reach those who would not want to meet people in person. Next slide, please. So in reaching KPs through social media, we believe that it's very important to have content we can share, and content that is easy to read, it's concise, with very short messages that are also straight to the point. For people to easily read and then understand what the messages we are putting across, as against sharing long text messages where people might not be willing to read. So as a result, we at WAF, with support from FHI as well, develop content for sharing. And one thing WAF does as an organization is that we task our interns, and for both foreign and local interns, to develop contents for social media platforms. To do that, the interns engage staff and volunteers of program interventions, and then just to understand the programs we are implementing, and also the population types, to ensure that the content that we have developed is tailored to the specific population. Content for social media is then developed into infographics for easy communication, as I mentioned earlier, and then content is shared with peer educators, PrEP champions, through staff of WAF, and then the subs we are implementing the project with, who in turn share with their peers and then share on their social media platforms to reach KPs that are usually not reached through the traditional outreach approaches. Next slide, please. So for online demand creation, first of all, we have several social media apps we are using, like Grindr, TikTok, Facebook. Grindr is a dating app, Grindr Blood, and Tinder, TikTok, Facebook, Instagram, Snapchat, and then a locally developed social media app, which is called Jodel. It's an app developed by students from the University of Ghana, and it's widely used among university students. And so through that app, we are able to reach a lot of the university students who are key population. All right, so for the approaches we use, we have customized social media accounts we use. Due to security reasons, we do not use to some extent, we do not use personalized social media accounts for education. Peer educators and PrEP champions are able to post some of the social media content on their personal social media accounts. However, we have dedicated social media accounts that have labels that clearly states that we are providing education for PrEP and HIV/ST. So once we post content on social media, people see it. Once they click on that, they see other content from the previous posts, and then they're able to interact with us through those sites to get more information, and then we provide education as well. So on the customer side, we post regular content from time to time. Sometimes we just have, aside the infographics, we have messages, very short messages we also post there to get the interest of KPs to reach out to us to get the services they need. And we also use social media paid apps. We know that once you pay for some of the apps like Grindr and Tinder, it expands your reach and then coverage. So we're able to reach more people once we pay for the app. So we use that so we can have a wider coverage, and then create demand to more people who we wouldn't reach on apps that we have not paid for, or even on Grindr when we have not paid for, we've not paid for a subscription. All right, then we also use social media influencers on platforms such as TikTok, Facebook, Twitter, and Instagram. They share educational materials, and then the content we create for a wider coverage. Next slide, please. Through the Quick Res aura, we also have implemented a virtual enhanced peer outreach approach to reach and educate clients who are high risk, and then clients who are usually not reached under normal circumstances. And then with Quick Res is not a social media app, so we don't exactly post on Quick Res, but we have Quick Res as part of the content that we share to enable KPs book for or make reservations for HIV and then PrEP services. On the bottom left, you'd see a Quick Res, let's say flyer that we share on social media. We have a whole material that, a picture that shows how you can make reservations. And then we also add Quick Res links when we share our content on social media for people who would not want to interact directly with peer educators and then PrEP champions to go ahead and then make reservations for services at IHCC to ensure that they get the service without having to interact with any of our volunteers. We also use Facebook community platforms such as African Men Looking for Meaningful Relationships with Men to disseminate educational messages and then refer peers for service uptake. Such community platforms exist already for key population in Ghana. We just leverage on them to share our content and then messages to reach a wider number of KPs. Next slide, please. All right. So volunteers on a regular basis share flyers. That's the infographics we develop, videos, and then other VCC materials on the social media platforms, be it their personal platforms, be it the dedicated social media platform we create to reach our target population. And then we also have peer educators and PrEP champions collaborating to create WhatsApp groups where links are shared for KPs to join to have an interactive session and then referral for services. With this, we realized that sometimes the conversations get very interesting, and then there are questions that come up that go beyond the knowledge of the peer educators and then the PrEP champions we have. So once in a while, we have nurses and then sometimes physician assistants and people who have more knowledge in the area come onto the groups to provide answers to the questions that are being asked, and then also interact with the KPs in that group. Now, enhanced COVID-19 education on vaccine hesitancy and referrals for vaccination through the engagement of social media influencers on TikTok and Facebook is another thing we do. Volunteers also share the quick links, like I mentioned earlier, to ensure that clients who do not want to interact directly with peer educators and prep champions are making reservations to receive services at the facility. On the left of the slide, you see some of the infographics we share, and daily one prep pill daily to protect yourself from HIV, among others. And then the quick res ad goes with it, and then the link is shared along with the content to ensure that people can make reservations for the services they need at IHCC in terms of PrEP, HIV, ST, and then COVID-19. Next slide, please. So the next slide talks about some key achievements of PrEP and HIV, ST for the fiscal year 2022. That's from October 2021 to September 2022.
Simon, are you still here?
I think we might have lost Sam. Maybe we can move into the next slide. So here's some challenges and solutions that the WAF team in Ghana has faced. A lot of it linking the clients reached online to outside sites for PrEP and services. So one of the solutions has been linking the clients to other implementing partners and facilities that are providing PrEP and HIV services in their communities. Yes. Some security issues on social media, so Hi. Bullying. There's Sam. Okay, great. Sam, maybe Hello? You can review some of the challenges and solutions. Samuel.
Okay, all right. I think I lost connection for a bit. All right, so in terms of challenges, we have difficulty in linking clients reached online outside of WAF's implementation sites to PrEP and HIV ST services. Because social media is very wide-reaching, we're able to reach people from different regions of Ghana and then different places, and sometimes they want the services we are providing, or they need the services we are providing, but we are unable to refer them all the way to our implementation sites to receive the services. And what we do to mitigate this challenge is to link KPs reached to other implementing partners and then facilities providing PrEP and HIV
Samuel, I think we've lost you again.
Hi. Yes, sorry about that. I'm back again. Okay, so yes, volunteers also experience some security issues on social media, such as social media bullying. And what we did along the line was to provide safety and security training, and then reporting mechanisms training for peer educators and PrEP champions to be able to, first of all, even identify cases of social media security issues, and then how to report these issues to us. Another challenge is bad network and high cost of internet data. And unfortunately, I'm also experiencing bad network. But yes, that's a challenge we have. The project currently supports community volunteers with communication in the form of internet data. We also have limited access to smartphones by some peer educators and prep champions. Some of our peer educators and prep champions do not have smartphones, so we target peer educators with smartphones for the online demand creation. And then we're also exploring the possibility of supporting volunteers with smartphones. Next slide, please. So the next slide talks about the next steps. And for the next steps, we intend to expand online demand creation, that is explore other social media platforms that we are currently not using for PrEP and HIV service uptake among KPs, especially TG people. And then we also intend to have continuous engagement of PrEP champions with PrEP users. That is, continue with interactive social media sessions where experiences are shared on social media platforms. And we intend to have KPs who are on PrEP and have used HIV self-testing services to also share experiences if they want to and can. Yes, so that's one thing we're doing. We are not necessarily engaging them as PrEP champions, but to have a wider number of people or a broader number of people sharing their experiences, we'll bring on board clients who are already on PrEP to share some of their experiences on these interactive sessions. And then we will also continue to train our volunteers on online safety and security to ensure that they can identify safety and security issues and then know what to do in cases where there are safety and security issues. And we also, moving forward, will expand demand creation for STI services and then monkeypox screening. Monkeypox has been added to quick res, and we're able to make reservations for screening. So moving forward, WAF will be, through the volunteers, will be creating demand on making reservations on quick res for monkeypox screening, and then for STI services as well. We have been creating demand for STI services, but not on as large a scale as PrEP and HIV/ST. So moving forward, we're going to do both monkeypox and STI hand in hand with HIV and PrEP services, and then COVID-19 services as well. Thank you. That's the end of my presentation, and I'll take any questions and comments.
Samuel, thank you so much for that insightful presentation about Ghana's experience with using social media to promote services. I see that we have one question. It's from Bashiru, and he's wondering about the strategies to have dedicated social media accounts and the costs for those different platforms that you might be using. Can you speak a little bit about how you set up these accounts and some of the costs that people need to consider?
All right, so for setting up the accounts, in the past, one thing we realized was that once on a platform like Grindr, for example, once you have a personal social media account where you are creating demand, people come, for what we call in Ghana fun. So they come for sexual interaction. So sometimes they end up not listening to what you are, the messages you're sending to them. They end up not reading them, and then they just block you. But once we started creating dedicated accounts on social media platforms, we realized that it was easy for people who needed the services to reach out to us on those accounts for the services they need. Sometimes you realize that someone will text you and say, can I have some condoms? Can I have some lubricants? And then from there, we give some more education about PrEP, HIV, ST, and then the other services we provide. Now with the cost, I may not be able to specifically state an amount. However, for Grindr, Tinder, I don't know if the subscription costs differ from country to country, but in Ghana, we are paying about 100 cedis a month for and above 100 cedis and above a month for subscription on Grindr, and then Tinder, I think, which is less than $10. So basically, that's how it is. Thank you, and over.
Thank you, Sammy, for that. And do the costs depend also on the number of people that you're trying to reach, or is it a flat rate?
It's a flat rate for some of these apps. Flat rates. You pay, and then it gives you coverage to a lot of people. Once you pay for the time, that is it. You reach as many people as are also paying for the app or subscribing to the app.
Okay, thanks, Sammy. And I see one more question here about maybe you spoke a little bit about it, but maybe you can share a little bit more information about how your volunteers were recruited to participate.
All right. So with recruiting volunteers, one thing we look out for is volunteers who have some sort of social media presence, who are active on social media. And that's one criteria for selecting volunteers, because we are focused mainly on the social media approach. We usually need volunteers who are into social media, have a presence, know how to use the various social media apps, and a lot of times have a lot of following. So that's one thing we look out for. But with the challenge of the smartphones along the line, sometimes some of their phones get damaged, and even though they can do the work, they do not have smartphones at the moment to reach out to people. So that's one of the key things we look out for in selecting volunteers. Thank you, Ndova.
Thank you, Sammy. And I see we have one final question here before we do our poll, just in terms of the WAF service delivery points that clients book services for apart from the International Healthcare Center.
Yes, I completely forgot to mention that. So aside the International Healthcare Center, we also use the partners' offices to provide services, especially HIV, ST services, and then PrEP services in the form of community services. And then we also have our mobile clinic that we use. So the mobile clinic is able to go around to provide services to people. So once you book for services through the mobile clinic, PrEP and HIV ST services through the mobile clinic, we call the client and then just schedule with the client when will be a convenient time to meet them and then provide the service. Also, because we do not using the mobile clinic is quite expensive because of fuel. So we schedule it such that in a day we can go to different spots to provide services to different people. So we, just to have some cost effectiveness. So the mobile clinic is one way we are providing services to clients in the community. Thank you, Ndova.
Great, thank you. So we're going to move on to our second poll. We have two questions here based on Sammy's presentation. If we can take a minute for people to respond. Again, the French translation is available in the chat. And for any of the questions that we have on the chat that we weren't able to answer, we can revisit them at the end of the presentations, or we will send responses in the chat for you. So Sarah, do we have some of the poll results available? Okay, so the first question around what, what online demand creation enables us to reach all of the following, except yes, it's reaching KPs in remote communities where internet access might be more of a challenge and more people might not have access. So it's really it's effective for reaching hard to reach KPs, discrete KPs, and high risk KPs, but not so much necessarily with remote communities. Which social media app can be used for online demand generation? We had here a multiple choice question. And so, yes, all of the above can be used for this type of demand generation. So Sammy, thank you so much for an excellent presentation. I'd like to introduce our next presenter, my colleague Thato. He's a consultant with our Going Online team, and he supports telehealth initiatives and programs around South and East African regions. He's passionate about the potential that technology offers to improve outcomes in public health work. Thato will be presenting on some of the Facebook activities and how Facebook ad managers, ad management capabilities can help you with demand generation. So Thato, welcome, and over to you.
Thank you very much, Shanti. Just a quick mic check. Can you hear me clearly?
Yes, loud and clear.
Great, thank you. Good day, everyone. Thank you for joining in. It's my pleasure to take you through this short presentation on Facebook ads and Facebook Ads Manager. Can you move on to the next slide, please? So, essentially, I think this is just going to be a quick crash course on Facebook ads and Facebook Ads Manager, and the potential that Facebook Ads Manager presents for the various programs that are currently utilizing social media channels for demand creation. Next slide, please. So in general, Facebook Ads Manager is a web-based platform. So that means it's not an app that you download on your computer. It does have a mobile app version, but essentially it's an online platform that is directly linked to the Facebook platform that basically consolidates all of your advertising management activities. So you need a Facebook account to be able to get on Ads Manager, but essentially what Ads Manager allows you to do is it simplifies the process of creating ads, measuring these ads, tracking the progress of these campaigns, as well as extracting any reports. Additionally, you can do things such as role management for all of your different team members, and managing the level of access within a campaign. Additionally, Ads Manager has a whole host of features, but some of the most important ones for demand creation really is the ability to run campaigns and use targeting tools to define the type of audience that you want your campaign to reach, to define the geographical span that you want your campaign to cover, as well as a bunch of other things such as the age of the audience that you want to reach, the types of interest that this audience has, the gender of this audience, and a couple of other factors that we will get into. There are a couple of other advanced features that can be used on Ads Manager, such as being able to control your audience reach by specifying the types of devices that you want your campaign to be shown on, and maybe tailor making different ads for different types of platforms. So you could run a different ad for users that are seeing your advert on computers and run a different advert for users that are viewing it on mobile devices. So generally, this is the type of ecosystem that Facebook Ads Manager allows you to do, and the type of features that it allows you to have access to when running a campaign. Next slide, please. So typically, to make sense of what Facebook Ads Manager offers, I think we kind of have to develop or at least adopt some sort of framework for how we can structure our campaign, from a cognitive standpoint, and then basically try and use Facebook Ads Manager to mirror this structure for the campaign. So, if you go into Ads Manager without a particular structure, it can be very easy to use the wrong tools for the wrong type of function. So this is a typical structure that I think would be a normal structure for a campaign. And typically the way you would think about this, the campaign level at the top there would kind of be the main goal of this campaign. Are you trying to drive awareness about a particular topic? Are you trying to drive an audience towards a particular site? Are you trying to drive traffic for a website? That top structure is pretty much where you define the overall goal. And then you would break that overall goal into kind of sub-objectives or strategies, if you may. So what are the key things that you really need to communicate about in order to reach that eventual goal? So you would break that down, and we will go through a detailed example just after this. So you would break that campaign down into subsets of objectives, and then each of those objectives would have a third layer, which is represented by the third layer on the diagram, where each different strategy is then represented by its own set of ads. Right. So let's go through an example just to kind of put this in context. Can you go to the next slide, please? So, using the same framework, we will take an example of a campaign that we ran recently with one of our partners in South Africa. And the main campaign objective was to drive awareness of HIV services for the MSM audience in the Johannesburg area. Right. So this part of the program is our partner runs a men's only clinic, and they wanted to drive awareness about that clinic and the services that they offer to their target audience within the Johannesburg area. So the main goal was really to drive awareness. So we broke that goal down and said, okay, how do we actually drive this awareness? So we decided to break that down into two separate sub-objectives. So the first thing that we would focus on is to drive awareness about HIV testing services. Educate people about the fact that HIV testing services are available in the area. And then we also wanted to drive some emphasis about PrEP, because PrEP is one of the most important services that the clinic offers in the area, specifically for MSM, who sometimes do not fit in well within the traditional health facility and might require much more tailored and discrete type of service. So we decided to focus on these two sub-objectives, and then these sub-objectives as well had different ads under them. So to focus on HIV testing, we decided to basically promote this clinic by running ads about the fact that there is a private and discreet way to get an HIV test done in your area. Automatically, that strikes some curiosity into the audience. Say, okay, I've been wanting to test, but I didn't know where to do it. Now that you're saying that it's private and it's discreet and it's available near me, I'm willing to learn more, right? And then we also ran a couple of ads about the operational period, letting people know that the clinic is open 5 days a week. So, at whatever time within that stage of consideration, whenever they find time to go in for a test, or whenever they're ready to book a test, we've kind of already driven awareness about the fact that they can do it on any weekday. Similarly, on the PrEP side, we just ran ads to promote, exactly what PrEP is about, to educate the target audience, as well as to try and meet that education with kind of a call to action on where exactly they can get this PrEP in this area. And the reason why this is really important is because some of the clients that use, the services of this clinic only get PrEP at this one clinic. They don't get it anywhere else. So it was critical for us to kind of focus on those different facets. So this is just kind of, a simplified version of how you would break down a campaign. And then this type of layering makes it easy for you to then set the campaign up on Ads Manager, which we will go through shortly. It makes it easy to segment your audiences by interest, to segment your audiences by objective, and to separate your campaign into different budgets. So, this is kind of a framework that would help put your entire campaign into the context that's easy to adopt on Ads Manager.
Thank you, Sato. I think we have a poll.
Oh yeah, I think we were supposed to have a question here. I mean, we could do it either way. We could do the question now at the end.
I see Sarah's
Okay,
brought
great.
it up for us.
Yeah, so, having just gone through that, there's a question here. In which of the following sections is audience targeting and segmentation done? And I might guide you a little bit here. Remember, campaign level is where we define the overall objective. That's the first level. The second level is the ad set level, where we break down our overall objective into sub-objectives, right? Into different ad sets that can be separated by audience, that can be separated by budget, that can be separated by topic or by interest. So ad set level is where we break down that entire objective. Then the ad level is where we specify the types of ads that will run per ad set or per objective. Then we have another option that's Facebook Audience Manager. So you can get your answers dialed in. All right. Yeah, I think we can close the poll. Okay, great. So majority of the answers say Facebook Audience Manager. The correct answer is the ad set level, but I'm a little bit guilty here. I kind of used I used some wording to try and throw you off here. But Facebook Audience Manager technically isn't the correct name for the platform we're talking about. We're talking about Facebook Ads Manager, and the ad set level, as I previously mentioned, is where we break down our campaign into different audiences. So that's pretty much the ad set level is where we segment our audience. So that's where audience segmentation is done. But maybe this question came a little bit too early. That's my fault. I will go through this again in a slide that is to come. But essentially, this is the interface of what Facebook Ads Manager would look like. You can use Ads Manager to manage ads for all the pages that you have access to, that you're an admin to, or that you are an editor to, that you have the right privileges for. But the functions that you're able to perform within Ads Manager are controlled by the type of access you have on that page. But essentially, this is what the interface looks like. So if you would just look down the middle, we have sort of folders where there's campaign and ad sets and ads. So you first specify the campaign. You give your campaign a broader name. So driving awareness about MSM services in Johannesburg, for instance. And then on the ad set level, which is the next slide, please, is where each campaign would have different ad sets in it. And again, the ad set level is really where we define, or we break down the overall campaign into different audiences, different interests, different topics, and so on and so forth. And then each ad set will have ads that will run within that ad, right? So, borrowing from our earlier example, if talking about PrEP, we could decide to run 3 different types of ads that appeal to 3 different types that kind of approach the topic of PrEP in 3 different types of ways, right? So the ads really are the way in which you get your message across based on the ad set. But I think I'll put this further into perspective when I go through a case study next. So please go on the next slide. Great, so I will go through a short case study of the example I gave of a campaign that we ran for one of our partners in South Africa. The name of the organization is Engage Men's Health, and they run a men-only clinic in Johannesburg. And this clinic really is targeted at providing services for the MSM audience within the Johannesburg area. Next slide. So just a little bit of background. We ran a social media campaign focusing on increasing awareness. So we really wanted to increase awareness about the clinic itself because the brand name is associated with, certain types of services. So it was important for us to also try and promote the brand and the brand of the clinic so that it's, it's associated with the types of services. We also wanted to provide some awareness and drive some awareness about the types of services that people can access at Engage Men's Health. And this is particularly for MSM in the Johannesburg area. So this is really what the campaign was all about, increasing awareness about EMH's men-only clinic, targeting MSM in the Johannesburg area. So as mentioned previously, the campaign would address HIV testing. We would also promote PrEP, as well as the EMH brand, because it is well known within the MSM target audience in the area. And we also wanted to kind of put some emphasis on why our audience should pay attention to the clinic, because it is tailor-made for our audience. The types of services that are given are are private and are discreet. And these are factors that are extremely important for the type of audience that we're trying to reach. People want to know that this clinic is really made for them and that they will be able to get services without any stigma in a private setting. We also had a call to action on some of the ads, and really the call to action was that whenever clients would see an ad, we would prompt them to send a WhatsApp to EMH's WhatsApp number. They have a WhatsApp number that they use as the main communication channel for clients, for the clients that use our clinic. Next slide, please. So I did mention that we would go back to the ad set level and why it's really an important thing, and how you can use this within Ads Manager for your different types of programs and activities. So, as mentioned, our target was really to drive awareness about, this MSM clinic in the Johannesburg area to a particular type of audience. So within the ad set level, you get to define the type of audience that you want to reach. So you can see on the diagram on the screen, you have an age indicator there where you can define the age range of the people that you want to reach. In this case, it was men aged between 18 and 55. You can also define the location of the people that you want to reach. You're not limited to one location. You can add different locations there. So if you have a campaign that's focusing on metropolitan areas, you can add all those different types of cities in your country and so on and so forth. You can also add a radius. So you can say, I want to reach people in Johannesburg and within a 25-mile radius of Johannesburg. And the reason why this is also a kind of a neat option is because some people don't live in the area that you're targeting. They live on the outskirts, but they come and work within that area, right? So where necessary, you can kind of target people within the vicinity of the main area that you're targeting. And then the part where you really need to then broaden your understanding of the audience that you want to reach is the interest section. So the interest section is pretty much where you type in a number of interests that you know are associated with your audience to get Facebook to show your ads to the right people. So you kind of need to really understand what your audience is interested in and what type of interest may be associated with the type of service that you want to offer. In our particular case, we targeted any users that might have an interest in drag shows, in reality TV, in articles that maybe had information about LGBTQI information, or articles about gay marriage legalization and so on and so forth. We had a bunch of other interests there, such as grooming products or gay dating apps, such as the ones that Sammy and Anthony were talking about, Grindr and the like. There might be a local equivalent wherever you'll be running this advert. But it's important for you to know what your audience is interested in, because these are the only things that you can kind of use to try and improve the likelihood that your campaign will reach the right audience. Unfortunately, you cannot target people by specific interests. You cannot target people by interests that may be indicative of their sexual orientation, for instance. So you really need to develop a good understanding of your audience. And then the result of all of this is that the Facebook Ads Manager will give you an estimation of how many people in this area within this age range have this type of interest, right? So as you can see at the bottom there, it'll say your estimated audience size. In our case, it was 1.3 to 1.6 million people. So that then gives you an idea of how many people there are to reach. And then when you add in your budget there, it then kind of gives you an indication of how many people within this 1.3 to 1.6 million people, how many people can you reach with your defined budget. So that those are tools that basically then allow you to manage your campaign and decide how to prioritize different areas. Next slide, please. So bearing all of this in mind, in closing, we ran this campaign over the span of 3 months. Within these 3 months, we were able to generate a total of more than 31 million impressions and reach more than 3 million people in the area. And impressions basically is just how many people saw your ad and how many times they saw it. So impressions is 3 million people times 10. So in this case, these 3 million people saw each ad about 10 times, or at least saw an ad in a campaign about 10 times. We also got about 10,000 direct inquiries on EMH's WhatsApp line, which are people making direct inquiries or booking appointments and so on and so forth. And these are tools that are available within Ads Manager. So as your campaign goes, you can see how many people you're reaching, how much money you're spending, and you can optimize your campaign as you go because you have a whole host of reporting tools. Next slide, please. Great. So just in closing, I can leave you with a few options or a few of the best practices that I have seen that can improve the likelihood of a successful campaign. The first and obvious one is that Facebook optimizes ads based on how they will improve the user experience. So if you have an advert that has a lot of text on the artwork, it will not get prioritized because the algorithm just deems that people might not like seeing a really busy ad. So try and limit the text on your ads to at least less than 30% of the area of the artwork. Know that all the other information can be written on the caption. So you don't need to write everything on the artwork. Additionally, if you're using video, because video is very popular now, adding transcription is one thing that you can use that can drive your watch rates up, because then you only have about 3 seconds when someone opens a video until you lose them. So if they feel like they can't hear the person speaking on the video clearly, or they feel like there's an accent difference, they may click away. So adding transcription increases the likelihood that they listen to the entire video. Ad frequency limits is also something that you can set on the ad set level, and basically that just is where you define how many times each user should be shown an ad. And the reason why this is important is because if you don't set an ad frequency limit, your ad may be shown to the same user several times, maybe more times than necessary, which then means that you're not optimizing your budget to be spent on reaching newer people. Your budget is being used to reach people that have seen this ad before. Additionally, I think there's a lot of documentation online about A/B testing, which is basically just testing different types of artwork that may be similar or have one control difference. So maybe the same advert, one with a lady, one with a man, seeing which one performs best, and then running the ad that performs best based on that A/B test, and not automatically assuming the one that you think will do best from the beginning. And then the last one in closing, really, Facebook Ads Manager is a sensitive platform. The changes that you make there, as soon as you save them, they become active. So limit the number of people who have access to Ads Manager to control the way in which changes are made, and to avoid any surprises. Because once you're running the ad, there's real information there reaching real audiences, and sometimes real money being spent. So you want to try and limit the amount of mistakes that can occur within your ads manager. So I think that's the last slide of my presentation. So I'm happy to take any questions regarding Facebook ads and ads manager. Thank you very much.
Thank you, Thato. And I believe we have a final poll, Sarah. Maybe we can run that before we get into any questions. There we go. So for the final question regarding Thato's presentation, which of the following was mentioned today as a factor that can negatively affect ad performance? And you have several different options there. It's a single choice option. So why don't you, we take a minute for people to be able to answer. Again, the French is in the chat. Okay. And maybe while we wait for the results, here they are. So having too much text and artwork on an ad, 59% indicated that was the correct answer. And in fact, yes, that's what Thato was suggesting, was making sure that your text is no more than 30% of the artwork, so that it doesn't, you don't have too much text and it's easy to read. Okay, great. So before we move into our closing session, I wanted to invite participants to ask any questions they might have. It doesn't look like we have any questions. So I wanted to invite participants, if they had other questions from previous sessions that they wanted to discuss, I saw, or that they wanted to ask. We had one question for Samuel that we didn't get to. Samuel, there was a question there about whether or not you've evaluated the impact of using promotion on social media, and if you've had if the WAF team has had any opportunity to evaluate the impact of these social media adverts on quick res. So have they led to more bookings? Have you looked at data around that?
All right, thank you very much for that question. I think that's a very interesting question. Unfortunately, we've not been able to do any evaluation on the impact of social media on the quick res, but that's something we will look into in the very near future to do and then see what the impact is. Thank you, Indova.
Thank you, Sammy. And like we mentioned before, for the evaluation of these types of social media tools and using social media for the promotion, if you do use them with a tool like the Aura, the online booking and case management app, each of your various different campaigns can have a specific code. It's not something that's seen by the client. The client just sees a link that would take them to book their services online, for example. And but with that special code, you would be able to look at what you would be able to see the number of people that had effectively seen your ad, clicked on the ad, and arrived at the online booking. So that way it really helps you identify some of those sites and some of the social media sites that are the most effective for bringing people in. Okay, can we have the next slide, please? So the links for the daily evaluation, there's an English and a French version, have been shared in the chat by Fatu. So we please encourage all of you to complete one of the evaluations. It really helps us make sure that the webinars, it gives us information, and your comments are valuable for helping us improve the webinars. I hope that today's session on social media use was able to provide you first with an overview about what tools are available and what frameworks and roadmaps are available for social media, and that you also were then able to capture and learn from some of the concrete examples that we had from our country programs. I want to thank all of our presenters. I also want to thank all of the people that worked behind the scenes. We had Sarah, we had several translators, we had Fatu organizing and making all of this possible. So thank you all very much for your support and your help in making this be a successful webinar. And I just wanted to also remind people that the second and final webinar session on virtual case management is scheduled for next Thursday, February 16th. So we hope to see you there for that webinar. In the meantime, if I can just remind people to please fill out the daily evaluation, that would be great. And thank you all for taking time out of your day to be with us here today. Thank you so much.